know you're laughing, but I don't. Because for me, the first port of call is always psychoeducation.
Okay.
What I don't like to do is use my power as a clinical psychologist to tell people what they haven't or don't have. I provide knowledge for people to make their own decisions around whether this is going to be helpful.
It's going to be helpful.
So for me, when I meet somebody that is a victim, a perpetrator, whatever, it's about providing education on, actually, let's talk about trauma in the way I've kind of defined it to you. Let's define PTSD. And usually with the definition of PTSD, I would break it down. So P meaning post, after. So actually after you've been exposed to a difficult situation, and I have to be quite mindful of the language I use, because a lot of them aren't going to be relating to words like scared and all of that stuff. So I'm often talking about like mad situations. So they're able to kind of articulate what that means. The T being traumatic, that actually in that moment it was so mad, it was so extreme that you felt a type of way, you felt different.
Yeah, exactly. It passed the threshold of how you normally feel in your body.
Like, you felt different after that situation for various different reasons. And then this is where I might be naming some of the different trauma responses for them to identify with. Usually I'm talking about kind of nightmares, the on edge and scanning around, because lots of young people, they do that. They often find it helpful to put a name to that when I'm talking about hypervigilance. And then the D for me is the important part, because this is where I'm saying this is the disorder. Meaning that actually, if we don't do anything about this, this is going to have long-lasting effects. This will be something that actually you're probably having to endure for a very long period of time. But I often explain to people that a lot of people don't. So actually, the D then becomes powerful, that if you want to do something about this, then these are the possible options of what could be helpful. So just psychoeducation. I don't force anything on anyone.
No, that's powerful.